Ladies and gentlemen, please welcome President and CEO of AmeriCares and Concordia Leadership Council member Michael Ninehees and our distinguished panel.
Good afternoon. Thank you for staying with us late in the afternoon. We appreciate your interest in this topic. We appreciate Dr. Biden's remarks about the importance of health as the gateway really to the rest of development, and we'd like to expand out there in this panel. We have a situation in the healthcare system around the world that not long ago in conflict zones, health centers were safe zones. They were well-marked. Health workers knew they could treat their patients well there. Patients knew that they could come and be safely cared for. Today we hear way too many stories of health centers under attack, of health workers killed, of clinics and hospitals being put underground to avoid attack. Those are the most dramatic stories, but in many parts of the world, various types of insecurity lead to broken health systems. Insecure environments can leave health centers isolated from the rest of the health system. They can cut off their supplies of medicines and other important commodities as well. And the reality is that the people who are affected by poverty and disaster around the world need access to good quality health care if they're going to make social and economic progress. They need thriving local health centers that are the backbones of health service to be available to them. In the next 40 minutes, we're going to talk about how to sustain critical health services in insecure settings so that people have access to the health care that they need. We have a great panel to have this discussion representing government, civil society, and the corporate setting. His Excellency, the former President of Nigeria, Olusegun Obasanjo, is with us. Please greet him. Carolyn Miles, CEO and President of Save the Children, is with us. And Joachim Reiter, Group External Affairs Director of Vodafone Group, is here as well. Thank you. I'll turn to the panel in just a minute, but I wanted to add that at AmeriCares, our particular focus is on the local health centers that provide the backbone of health service to people around the world. And we have seen in many parts of the world that insecure environments, conflict in particular, but other types of insecurities, really do affect how these health centers operate. In places like Syria, for instance, where we've been supporting the operations of a reproductive health center within Syria with our partner, the Syrian American Medical Society. We provided mental health counseling and training to the health workers who are there. So we've seen firsthand what it means to be a health worker in an insecure setting and how difficult that can be. That's true, too, as well for Save the Children. So I want to turn to my colleague, Carolyn Miles, first, and just ask you from your perspective in the field, how bad is it today for health workers and for health centers?
Well, thanks, Michael. Health systems are the kind of thing you don't think about until it doesn't work. And I think I'll give you two examples of where a health system really failed and where I saw a country in crisis where actually it was able to work. So the first example is I went to Liberia very shortly after the Ebola, kind of the peak of the Ebola crisis, and sat with a community health worker, a nurse in a hospital there. And she told me, and this was obviously a really hard thing for her to tell me, but she told me what had happened when Ebola had hit, and they really weren't prepared, didn't have the right protocols, didn't know what to do. She was one of only 18 people that lived in that hospital setting. There were 120 people that worked in that hospital, and 19, including her, actually survived Ebola. So that's a striking example of where if you don't have a health system that's prepared, obviously it can result in tremendous loss of life. On the other hand, I was just in Kenya this summer and visited one of the hospitals in Kenya that's practicing something called kangaroo mother care. Now, Kenya's going through a tremendous drought. So, you know, this was a health center that was really having lots of challenges, but they had been trained in how to make sure that moms could take care of their premature babies, even in very low resource settings where there's no electricity, right, by wrapping the baby and putting the baby on the mom's chest. We do it here in the United States when people have premature babies. We've now tried to get that spread around the world. It's an example of where even in really low resource settings, as long as you do the work ahead of time and you make sure that people are trained and they're ready, you can actually survive those kinds of critical crises.
Yeah.
So those are just two quick examples. But as I said, we don't think about health systems until they don't work.
Yeah, that's right. And Mr. President, leading a very large country in Africa where I'm sure there are many well-functioning health centers, but also others that are probably struggling as well. What have you seen on the ground in terms of what's changed that makes health centers either more or less vulnerable in insecure settings and their ability to serve their population?
Mike, thank you very much. Let me take the example of the Boko Haram areas where the remote cause of Boko Haram itself is inadequate development, education, healthcare delivery, infrastructure in the northeastern part of Nigeria. But when there is conflict, even the limited facilities is overstretched or, in fact, completely destroyed, either by the insurgent or by the military action of those who are pursuing the insurgents. And therefore, for the ordinary people, the inadequate facilities become non-existent. They are scrambling for life, and healthcare delivery becomes really non-effective. And even people who come from outside to help, there's very little that they can do because life becomes unsafe. And in a situation of life being unsafe, healthcare deliveries, it's almost impossible. And that is the situation we found on our hands in the northeastern part of Nigeria, where Boko Haram is working.
And is there a formula there to improve the security that maybe hasn't been even tried yet, that you might be able to advise other governments at this point to provide a safer environment?
Well, I believe that because the Boko Haram and people like that we are dealing with, they don't obey any rule. They don't obey the what I call the Geneva Convention. You have to treat people, and particularly healthcare people, in a particular way. In fact, for them to be harsh on people who are delivering healthcare is to them a matter of showing that they are strong and they are powerful. I believe that the international rules for engagement should actually punish anybody who deals on in the manner that they have been, that healthcare people, MSF, people have been dealt with recently in countries like Burkina Faso, in Mali and so on should actually be charged for
War crimes?
war crimes
Yeah.
in such a way that it doesn't matter where they go. The international community can catch up with them. It has to be that strong. Yeah. Otherwise, how do you find? Take the case in South Sudan, a country that the whole world stood by them to get independence, and, well, they failed to even manage their so-called independence properly. And then people who came in to help them while they are messing up the independence that they have got, they kill them in cold blood. It is heartless. It is callous. And people like that should never be allowed to get away with it.
And before I go to Joachim, yes, for sure. Carolyn, one more question for you, and that is, there seems to be something that changed in the last few years that turned health centers in conflict zones from safe zones to targets in the way that the president was speaking. Any sense of what that was? What has happened there?
I think that's right. I think it's not just health centers, but it's health workers. And if you look, actually just, I think it was last week, a young Spanish health worker that worked for the ICRC was killed in Afghanistan. So both health workers and health facilities are being targeted. And I think, back to the president's, I think, very astute comment that part of this is about making sure that those people that do those attacks are punished. I think that in Syria, this is a perfect example. I know AmeriCares is working there, Save the Children is as well. The maternal and child health centers that we are supporting there have been bombed multiple times. And this is an obvious targeting. This isn't collateral damage. This is obvious targeting. And when you think about, a war, one of the things that Save the Children says is, war should not be about children. There should be no such thing as a war against children. But yet, it happens consistently around the world in conflict. So I think this idea that we really have to do better at holding people accountable is a major part of the issue. But people have decided, and rightly so, when you take away that ability to deliver health care, right, it inflicts major, major suffering on the people that are under siege. Because the people who are getting injured now can't get any health care. Obviously, there is a real fear then of going to health centers to try to access health care. You kill health workers, so you don't have anybody to deliver the health care, right? So sadly, it's an effective war, tool of war, but it absolutely has to be stopped.
Yeah. I mentioned that we work with the Syrian American Medical Society, and they were describing to me one of their strategies had been to put clinics underground so that they could withstand explosions above them. And I just heard today the other problem they're having now is gas attacks at these underground facilities, which turn them just basically into gas chambers. So can't win going either way. Joachim, you've had experience both at Vodafone and in your previous work in these sorts of places, insecure settings, whether from conflict, whether from epidemics, outbreaks like Ebola. What do you see from the perspective of a corporate entity interested in technological solutions and other ways to impact there in your ability to go in and help?
I think, the first point and what is described, basically we have health workers being at the front line and incredibly vulnerable. Now, from our point of view, there are a number of ways that we can help, and we take very seriously that we do believe that we have an expertise and a requirement upon us to support those that are prepared to sacrifice everything to bring a better life for those that are vulnerable and in this situation. We do that in a number of ways in Vodafone. One is we have an instant network, so after natural catastrophes, we can deploy and build a communication network from scratch. Usually it's devastated, and aid workers cannot function effectively unless they're able to communicate. equally, those families affected by the crisis need to be able to communicate to each other, tell them that they're safe, or find a place where to bring themselves in order to be safe. So we deploy an instant network. What I really want to discuss on the health side, because that's where we sort of back up those that are really doing the hard work. On the health side, I mean, ultimately, we're a company that is locally ingrained. So wherever we go, we build infrastructure, we become part of that country and that journey of that country to a better situation. And what we have found in many developing countries we're operating is an enormous problem of access to healthcare. So despite the best intentions of trying to build up the healthcare facilities, particularly rural women and children are struggling to access those healthcare facilities. And that led us to a conclusion that we realized that actually we sit on a lot of technology to create the lifeline between the vulnerable individual in rural communities and the facilities that are generously built up with the help of NGOs as well as from donors, as well as from the government. A concrete example we had of that is in Tanzania, where in Tanzania there's a huge problem both with maternal mortality as well as injuries caused by obstructed labor. So the 3,000 cases per year of fistula. And this is a horrific condition because it basically marginalizes these women from becoming part of the society following the child delivery, let alone that it puts the child at risk. So what we did, there was a fantastic initiative by an NGO there to build a healthcare facility to address the fistula situation. But actually they didn't have any patients. So they were running, if you want, without patients. What we developed is a text-to-treatment, so we could reach rural women, we can bring them to the facility. Then we realized that actually they lacked the money to be transported. So we created an Uber ambulance type of facility. So we used our mobile payment solution that was generously created together with us, with DFID, as a public-private partnership originally. So any woman in a rural community that is facing a labor can send a text. We will then pay for a taxi driver to go and pick her up and drive her to a medical facility. And what we have seen, and we have partnered now with a number of both NGOs and the USAID, and rolled out a mobilizing maternal health care program in Tanzania. And we have provided interventions for 440,000 women already. And what we've seen, the women that we managed to bring to these facilities, we have an 88% reduction in maternal deaths, which is, of course, an incredible result. But it's actually, we're just providing the link to make sure that people can access all the good work of the NGOs, the governments, and donors to provide a better healthcare system. And we believe that it's our responsibility to leverage our expertise and our technology so that the weakest and most vulnerable also have the same access as those that are closer by to the healthcare facilities being built up.
Yeah, you really put a premium on communication and enabling that communication. Understand? Can you see how that would be applicable as well in more of an emergency setting? You're talking about a rural setting where people have difficulty accessing health services for all kinds of reasons, economic, geographic, insecurities as well. In an emergency setting, what's the overlay of that same technology?
So, I mean, what we do with the Instant Network, for example, is the UN organizations request us to fly in teams. We have around 70, and this is totally volunteers. These are ordinary Vodafone employees. They could work in a retail shop somewhere in sort of Scotland. And when the UN calls us, we have trained them to go to fragile situations. We will fly them there. It's basically a rucksack that within 10 minutes, a non-technical person can create a communication network that connects then that allows mobile phones to operate again, and therefore people can start connecting each other. So we work with the UN on that. We have also a very significant program with UNHCR on refugees. And that's both a mobility issue, but it's also a particularly vulnerable situation for the families that are ending up in refugee camps. And we've noticed that they are suffering from lack of access to a number of things. So in that particular situation, we not only provided communication, we actually used the communication to provide full educational packages for the kids. So Vodafone has committed, for example, by 2020, we will provide primary education for refugee children of 3 million. Predominantly in Africa. We are also providing already today education in refugee camps in Greece, for example. So this is a way where we're trying to link the technology with the content so as to fill the gaps that exist for particularly vulnerable groups, including in emergencies.
So Concordia focuses a lot on trying to profile public-private partnerships where governments, corporate, NGO, civil society work together. And I'm going to start with you, Mr. President, to ask, from a government's perspective, what is it that you really would like to see from the NGO sector and from the corporate sector that would improve the situation of health services in some of the more difficult places in a country like yours?
Well, particularly in the rural areas, I believe that we have to improve on what is actually there on the ground. There is a lot that is on the ground in terms of local hubs that have worked. We need to make sure that these because what is important is what is the ingredient in those herbs that are curative, and research to help them. And I believe that this is where both assistance from outside, NGOs, and countries that are giving aid in Africa. It's not as glamorous as going to teaching hospitals or standard hospitals, but a lot can be done in what I call primary health centers in these villages, where in any case private sector health delivery because they will not have money to be able to pay, will not go. In the cities and urban areas, private sector health delivery will be there. But in the rural areas, in villages, they will not go. So who will go there? It's the civil society, the local government, and whatever we can do to enhance what they already have locally, herbs and things that they have used to, that have served them, and that could also serve them. What is the curative ingredient that is, so that you know what dosage of these local, we call it native medicine. But it is medicinal. After all, most of the tablets that we get in patent medicine and in pharmacies have their origin in herbs and roots and leaves. So what I am saying is that these herbs that are there in villages and rural area, they need to know how much of it, or what dosage they should use to cure malaria, for instance, or any such disease. And I believe that this is where there can be partnership, public, the civil society, and the aid givers.
Yeah, I think your point's really well taken. There are primary health care centers, rural health centers that exist already that need capacity building, that need to be invested in, and what you're calling for there is for the civil society and the corporate sector to make those investments there. Not as glamorous or sexy as working in a bigger hospital or in a teaching hospital or something, but that's where the need really is. Carolyn, from your perspective, from the NGO, as you think about that response, what is it that NGOs need from governments and corporations to be able to make those kind of investments wisely?
Well, I think I agree with the president that a focus on strengthening the capacity of those health systems, although it isn't sexy, is incredibly important. That's what's going to allow, in a crisis, if those systems, those clinics and those health workers are there, even in the forest reaches, in a crisis, they're going to be there and they're going to be able to provide the support. So I think that's incredibly important. I think on the private sector, I mean, I love the Vodafone Uber ambulance idea. And I think what NGOs need is, as you said, it's about kind of getting to the last mile. And we have to think about what does getting to the last mile mean in a disaster and in an emergency, because it's always the people who are the poorest people that get impacted the most in any emergency. And if you look at, where mothers and babies are dying around the world, it's 80% of them are dying in countries where there's conflict and there's civil war and there's really difficult, a very, very difficult environment. And a lot of times the private sector doesn't really want to go into those areas, right? So I think we have to work together to say, how are we going to bring those solutions to even the toughest situations? Because I think that's where, particularly when a disaster strikes or you're in the middle of a civil war, that's where we don't have yet the right solutions to kind of get to those poorest people, which are the ones that are going to die and be most affected.
And Joachim, from a corporate perspective, what is it that corporations need from governments and NGOs to play an even bigger role in working on these issues?
Well, I think our experience is that if you look at the work that we've done under the foundation, which is basically charitable work, and all the things I've listed are basically charitable work. I mean, our experience is that actually we would not be successful on any of our projects if we were trying to do it alone. I mean, ultimately, for example, if you take Vodafone, we're a communications company. We're not a healthcare company. We're not a disaster reduction company. However, our expertise combined with other actors may actually contribute to increase the effectiveness and efficiency of those other actors' interventions. And that's really how we see ourselves. It's in the partnership. And that requires both with respect to NGOs and insofar as that we're allowed to, we would love to partner with governments. In our educational program, for example, we always partner with governments because we want to link the educational program that we provide, for example, for refugees, with the national curriculum so that refugees then can apply for education under the national education system once, hopefully, they can get out of the refugee camps and properly integrate into the countries that they exist in. So I think Carolyn's question is very tricky. I mean, is she correct to say that corporates do not want to go into the most high-risk areas? Yeah, absolutely. However, Hurricane Irma, for example, we have a team deployed. We deploy them immediately. They're volunteers. We have to train them. It's not our common business to train people to come into areas of hurricanes. But we have people that are prepared to do it, and we have the technology that can help. Same, in my previous capacity when I was ambassador, I mean, I was among those that came into Liberia after Ebola. And one of the things that I found fascinating, how a Dutch company running the harbor had kept it open with its staff during the entire Ebola crisis. And this is in Monrovia, the harbor of Monrovia is actually under a commission to a Dutch company. And they had their staff there. They made sure that the harbor was open. And that was a lifeline to bring in the supplies necessary to be distributed, be it food, be it health supplies. So corporations are trying to help, including the most complicated situations. We have to be very careful in how we help, also from the point of view of the risk that we take with our staff, just as I presume every serious employer will be very worried about the situation they put their staff into. But we are actually entering into a natural catastrophe. When we had Haiti, Nepal, we were there with our instant network teams. In refugee crisis, on the beaches of Lesbos, we were there with our staff providing communication, making sure that the NGOs who make a fantastic work, as well as governments in those situations, are properly backed up with all the necessary technology they need.
Yeah, great. Mr. President, I want to go back to your comment, your very strong comment about the fact that people who attack health centers, health workers need to be held accountable. What can we do as a collective of people who are interested in this issue? What can we do better to raise this issue, to advocate for adherence to humanitarian laws and protection of health workers as sort of a global voice? How do we do a better job at that in hopes that that might change something?
Well, collectively, we have to make examples. I believe that there's no other way to really put sense into those senseless acts, those who perpetrate those senseless acts, than to make examples. If the international community agrees that those who carry out such acts should be charged for war crime, and you take 2 or 3 in 1 or 2 locations, and they are charged for war crime, people will know that they cannot get away with that type of act. And then, of course, there should be collaboration of countries where these things take place and the international community, so that there will be no safe haven, no safe haven for any culprit. I believe it should take the collective effort of local, national, and international to make sure that nobody who commits such heinous crime gets away with it.
Carolyn, have you seen any cases of anybody being held accountable for this? And if not, why do you think that is so?
I think it's very hard to hold people. I can't actually tell you a situation where you've had a health worker killed or a health facility bombed and people have been held accountable. I think it's very tough to do. I think that's because, again, it's the fog of war or the fog of crisis, I guess. And I think we don't think about that collateral damage, if you will, that those kinds of acts cause. But I think that's exactly what you have to do if you're going to change the premeditated attacks on health workers and health facilities as an act of war.
Yeah. Any other sort of prescriptions you would have to sort of bring to the table to try to bring an end to this?
Well, I think one of the things that we spend a lot of time at Save the Children on is this whole preparedness issue. And I think it starts obviously with the people on the ground. And we do a lot of training of folks for both natural disasters as well as in war situations on being prepared and particularly on protecting children. I mean, obviously at Save the Children, we spend a lot of our time on that. And I think that whole, particularly if you're talking about natural disasters, most people don't help until it happens. And so many times you can do so much work on the prevention of the loss of life, and people don't think about those things beforehand. It's when it happens that people really react.
Joachim, I think I've always thought that corporations have a particular interest in the health of people in these sorts of countries and situations, which are future markets for them. Potentially. So they're going to become future markets if people have good health care, have access to care, therefore they can take advantage of education and employment opportunities and make economic and social progress. How do we rally more corporations around the issue of health services in these types of countries and situations?
I mean, you're absolutely right, number one, that there is absolutely no economic benefit for a nation or for the companies that operate in a nation with an unhealthy population, neither from an employer point of view nor from the operating environment that you're in. So there is a collective interest and therefore also collective responsibility to join hands and try to improve this situation. By the way, for me, it's not only health, it's also education. I think Professor Biden was absolutely true that these are things where if you invest, you will have generational dividends. And you can break paths that countries are in of repeated instability or repeated fragility by investing heavily in those social services. I think from the point of view of Vodafone, that's why actually health and education are two of our priorities, because we see a direct link. And it's not from a material self-interest. It's from the fact that we work in these communities and we care about the communities we work in. We care about our staff. we do not want to have unhealthy staff or staff that are struggling with educational levels or their children. So for me, this is a collective interest. Could I just add one point on the question about individuals that engage in breaking United Nations conventions on warfare? I think there has been a very good development on the corporate side, and the government's putting pressure on corporates to try to turn the taps off the potential of making economic benefits from engaging in war. That's what you saw in the conflict diamonds and now spreading to conflict minerals. I think from my personal point of view, having worked 20 years in government, I think this is where you will see increasing demands on corporations and where corporations will have to respond to those demands. There is an anticipation and an expectation from the general public, which is entirely legitimate, that corporations, no matter where they act and where they exist, they have to have full control of their supply chain and make sure that they're not using, for example, conflict minerals or slave workers or whatever it is. And that's something that has come over the last 20 years, and I actually think that's also putting increased pressure on companies to turn the tap and reduce the incentive for engaging in warfare.
It's a great point, thank you. And just as a final note, I think the healthcare workers who are serving people affected by poverty and disaster around the world are heroes. They're doing hard work on behalf of their communities, and they deserve our support. So I thank you for the strong words, Mr. President, and for the great insights from the panel, and let's give them a round of applause. Thank you.